It's been weeks, maybe even months, and your ankle still hurts. You rolled it, the swelling went down, you expect it to be back to normal by now, but something still doesn't quite feel right. Here's the thing, most ankle sprains heal just fine, but if your pain has stuck around, there's often another injury hiding underneath the surface that never got identified in the first place. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. In today's video, I'm going to walk you through 7 commonly missed problems after an ankle sprain, when persistent pain is actually normal, when it isn't, and when you should seek further evaluation. Before we get into it, if you're finding this helpful, take a second to hit the like button, drop a comment, letting me know how long your ankle pain is stuck around, and subscribe so you won't miss the next video. It genuinely helps other people find this information when they need it. Let's start with what actually happens during an ankle sprain, because understanding this makes everything else make a lot more sense. An ankle sprain means the ligament around your ankle gets stretched or torn. Most of the time, this involves what we call the lateral ankle ligaments. There are a few of them on the outside of your ankle, and occasionally the ligament on the inside gets involved too. You don't need to memorize the names, but just know that your ankle is held together by a network of these ligaments, and a sprain means one or more of them got overstretched or partially torn. Ankle sprains are incredibly common. Uneven ground, sports, a misstep off a curb, an everyday accident, it doesn't take much. That's why we tend to brush them off. Everybody's sprained an ankle at some point, so it doesn't feel like a big deal. So when should an ankle sprain actually feel better? This is important because it gives you a baseline to compare your own recovery against. Mild sprains typically improve within 2 to 4 weeks. Moderate sprains usually take between 6 and 8 weeks, and severe sprains can take several months to fully resolve. Now here are your red flags, the sign that something isn't following the normal timeline. Persistent swelling that isn't going down. A feeling of instability, like your ankle might give out on you. Locking or catching sensations when you move it. Sharp specific pain in one area, and repeated sprains where you keep rolling the same ankle over and over again. If you're noticing any of these, that's usually a sign that there's more going on than a simple sprain. Now, before I get into the 7 missed problems, I want to talk about something I see constantly in my office, probably the single biggest mistake people make after their ankle sprain. Here's what happens. The swelling goes down, you're walking without much pain, so you assume you're done. You stop doing your exercises, you stop paying attention to it, and you go back to your normal life. But here's the problem with that. Being able to walk without much pain is not the same as being fully healed. Most people never fully restore their strength, their balance, and something called proprioception, which is basically your ankle's ability to sense where in space it is and react quickly to even uneven ground and sudden movements. When you skip that last phase of rehab, you're left with an ankle that looks fine on the surface, but is quietly unstable underneath. And that sets you up for chronic instability and repeated sprains down the road. The one mistake usually ties into several of the 7 problems we're about to go through, so keep it in mind as we move forward. Missed problem number 1, chronic ankle instability. This is exactly what I just described. The ligament technically heals, but it never regains its full strength. This happens because the ligament remains a little stretched out, because rehab was inadequate, or because the muscles that stabilize the ankle stay weak. The symptoms are pretty distinct. You feel that your ankle is going to give out on you. You keep re-spraining it, sometimes using less to trigger it. Uneven ground starts to feel unsafe in ways that it never used to. Treatment usually involves physical therapy, focused specifically on balance and strength, sometimes bracing for extra support, and in more severe cases of instability, surgery may be needed to tighten things back up. Missed problem number 2, peroneal tendon injury. This one gets overlooked constantly. There are 2 tendons that run on the outside of your ankles, the peroneal tendons, and their job is to help stabilize your ankle and prevent it from rolling. During a sprain, these tendons can get injured too, ranging anywhere from tendinitis to partial tears, and in rare cases, complete tears. The symptoms tend to show up as pain, specifically behind the ankle bone, pain when you push off when walking, and swelling that tracks along the path of the tendon rather than the whole ankle. Treatment can include immobilization to let it calm down, physical therapy, sometimes regenerative treatments when appropriate, and surgery if there's a significant tear that isn't improving on its own. Missed problem number 3, an osteochondral lesion of the talus. This is essentially cartilage damage inside the ankle joint itself. The talus is one of the bones in your ankle, and during the original injury, the cartilage covering it, along with a bit of the underlying bone, can get damaged. This is easy to miss because it happens deep inside the joint, not on the surface where you'd expect an injury. The symptoms include deep ankle pain that's hard to pinpoint, clicking, locking, catching sensations, and swelling that keeps coming back even after it seems to settle down. This is exactly why an MRI is often necessary. A standard X-ray frequently won't show this type of damage. Treatment ranges from conservative care to injection therapies, and in more significant cases, arthroscopic surgery to clean up the joint. Missed problem number 4, a high ankle sprain. This one is genuinely a different injury altogether, even though it happens in a similar type of twisting motion. A high ankle sprain involves ligament above the ankle joint itself, called the syndesmotic ligaments, rather than the ones on the side of your ankle that gets injured in a typical sprain. Recovery from this typically takes significantly longer than a standard ankle sprain. Symptoms involve pain that's located above the ankle rather than to the side, pain with any twisting motion, and difficulty pushing off when you walk or run. This is frequently mistaken for a routine ankle sprain because the mechanism of injury looks similar, but the treatments and recovery timeline are quite different, which is exactly why it gets missed so often. Missed problem number 5, an occult fracture. An occult fracture simply means a fracture that wasn't obvious on the initial X-ray. Common examples include small fractures in the talus, the calcaneus, which is your heel bone, the fibula or the base of the fifth metatarsal, a bone on the outside of your foot that's notorious for fracturing during ankle sprains. The reason initial X-rays sometimes look normal is that certain fractures are subtle, positioned at an angle that's hard to capture, or they simply don't show up until enough time has passed. If you have persistent pain, difficulty putting weight on the foot, or tenderness at one specific spot, that's where repeat imaging becomes necessary to rule out a fracture that was missed the first time around. Missed problem number 6, nerve injury or entrapment. Not all ankle pain comes from bones or ligaments. There are nerves that run right through this area too, specifically the superficial peroneal nerve and the sural nerve, and they can get stretched or irritated during the sprain. The symptoms here feel very different from typical ankle pain. Think burning, tingling, numbness, shooting pain, or a kind of hypersensitivity where even light touch feels uncomfortable. If your ankle pain feels more like an electrical sensation than a mechanical one, a nerve injury is worth considering. We diagnose this through physical exam, imaging when needed, and occasionally nerve studies for more complex cases. Missed problem number 7, scar tissue, impingement, or synovitis. Sometimes the healing process itself creates new problems. As your body repairs the injured ligaments, it can form scar tissue that restricts your normal range of motion. You can also develop chronic inflammation inside the joint called synovitis, or soft tissue impingement, where extra tissue gets pinched during certain movements. The symptoms include pain with specific movements, limited range of motion, a pinching sensation in a particular spot, and swelling that just won't go away. Treatment typically involves physical therapy to restore motion, anti-inflammatory treatment, injection therapy, and in some cases, arthroscopic cleanup if the scar tissue or impingement isn't responding to more conservative measures. So how do we actually figure out which of these 7 is causing your pain? It starts with a careful history. There are a few questions I ask every single patient. Where exactly does it hurt? What specific movements bring the pain on? Does the ankle feel unstable or does it just hurt? And has it improved at all since the original injury, even slightly? From there, we moved into a physical examination, testing the stability of the ankle, evaluating the tendons individually, checking your range of motion, and doing some functional testing to see how the ankle performs under real movement, not just sitting still on the exam table. And then, depending on what we find, imaging plays a role. X-rays to check for fractures, an MRI when we need to see soft tissue, cartilage, or subtle bone injury in detail. Ultrasound, which can be useful for tendons in particular. And occasionally, a CT scan where we need more detailed information about the bone itself. So when should you actually seek out an evaluation instead of just waiting it out? Here are the warning signs to watch for. Pain lasting longer than 6 to 8 weeks, repeated ankle sprains on the same side, any locking or catching sensation, persistent swelling that isn't improving, difficulty getting back to sports or your normal activity level, and pain that's bad enough to wake you up at night. If you're dealing with any of these, that's your signal it's time to come in and get looked at properly. I also want to be clear that there isn't one single treatment for every ankle sprain, because as you've just heard, there isn't just one single cause for lingering ankle pain either. Physical therapy is often central to recovery, focusing on strength, motion, and that balance and proprioception work I mentioned earlier. Bracing can provide extra support when the ankle continues healing. Custom orthotics may help if your foot mechanics are contributing to the problem in the first place. Regenerative medicine options like shockwave therapy, PRP, or other advanced treatments can be appropriate in certain cases. And surgery is reserved for structural problems that genuinely aren't improving with conservative care. So if your ankle still hurts, please don't just assume that it's just a bad sprain and leave it at that. Persistent pain almost always has a specific reason behind it, and finding the correct diagnosis is the very first step towards getting back to the activities you actually enjoy. If you've been dealing with ankle pain for weeks or months after a sprain, don't keep guessing about what's actually going on. A thorough evaluation can identify what's been missed and help you get back on your feet for good. The link to schedule an appointment is right in the description below. And if this video helps you understand your own ankle pain a little better, do me a favor. Like this video, leave a comment letting me know how long you've been dealing with it, and subscribe so you catch the next one. Thanks so much for watching, and have a great day.